So first and foremost, just tell me your name and where you're from.
I'm Sandy Francis. It's kind of hard to say where I'm from. I'm from Colorado for sure, but.
Awesome. And tell me, Sandy, what was the problem you were having prior to undergoing the stem cell treatment?
Which one? Because my main problem was my knee, my left knee, which had gotten damaged probably in high school from playing soccer, and it wasn't too much of an issue for a long time. It would swell up sometimes if I went biking for a long time or hiking downhill. Then I started playing tennis, and it started swelling up more and more until the point where I actually could barely bend it. And then I was at the point, my doctor had told me a few years before that I really needed to have my knee replaced, but I was almost at the point of having it cut off and replaced with some metal. And then I heard about Thrive MD and themselves, and went through the process with Dr. Brandt, and was back to playing more tennis than I was before. I could play singles. I didn't have any swelling issues or pain.
And about how long did that take, Sandy, after the initial procedure? So you were back, doing what you love to do.
Well, I went back after a month.
Okay.
The other thing I wasn't able to do was ski all day. I could ski for a few hours. I could manage the pain, but that was it. And now I could ski all day.
All right. Some of your issues a little different than some people. Why don't you tell me just a little bit about what subsequently transpired with the areas you had treated?
Well, I've had, at that first initial time we did my knee, I also had a problem with tennis elbow, which pretty much had been going on since I've been playing tennis, and been for years. And we did treat that and have had no problems ever since. I haven't had to wear a brace, no pain at all ever. And let's see, I did find out that I had some degeneration of a disc in my back. And we treated that with stem cells a few years ago and had no issues with that. I did have, almost a year ago, have a problem with a part of my cartilage breaking loose, a little piece that caused caused some damage and some inflammation, and it was difficult to get around on it and to bend it. And I did have that taken out arthroscopically, and then we treated it again with stem cells a few months ago.
And now it's doing pretty well.
Now I'm back to playing tennis again.
That's awesome.
No fear of this ski season.
Tell me this, how did you end up finding Thrive MD, and why did you choose Thrive MD over the other many choices out there in the world?
Well, I found out about it because my mom saw an article in the newspaper of somebody who was well known in Vail that had gotten treated by Thrive MD, and the article said that he was back out skiing all the time again after doing that. And for me, I didn't see that having an artificial knee was really a great solution because it is traumatic to the body. There's a lot of problems with replacements, with infection. My mom had both her knees done. One of them got infected. They had to take that out, and it was a rather long and arduous and painful process of putting in another knee, and the second knee is not as strong. So she definitely can't be doing anything active. I'm hoping I'll be active when I'm in my 70s and 80s as well.
Me too.
Even my surgeon friends have told me, well, you're too young to have a replacement. So doing stem cells has been a great and I think healthy alternative to getting
awesome. What would you say to other people that are on the fence, sort of thinking about, should I go forward with a stem cell procedure? I'm not sure this is something I should do.
Well, I've told them, I've recommended a lot of people talk to you, and I've told them that there's really no downside other than you spend the money and go through, a little bit of pain. The pain is really pretty minimal. and you can get the back and active very quickly versus a replacement. And I think once you do the replacement, there's no going back. With stem cells, you can still go ahead and do a replacement if you really think you need to. The other thing too about Thrive MD is that there are a lot of people messing around with stem cells, but if you research what a lot of people are doing, they aren't doing the full array of what Dr. Brandt has been doing, and Dr. Brandt has been playing around with it and refining it over time. And his first procedure differed a fair amount from what he did the last time. He's continued to add to it and refine it and make it better. And there are a lot of other people out there saying they can do stem cells, but it'll end up being just stem cells from blood, which doesn't have that much stem cells in it, or maybe just from bone marrow, which again doesn't have as many stem cells as the fat, and it doesn't always work as well either. So I think Dr. Brandt has a much better understanding of how it all works and how to make you better.
Awesome. Sandy, thanks so much for your impact. Do we have your permission to utilize this video testimonial?
As best as you can, yeah.
Okay. Well, thank you so much.